Alright guys, welcome. Today we're going to be talking about Baclofen. So we're going to keep it simple for you guys so it doesn't take you too long. Baclofen is a centrally acting muscle relaxant. So the word is already telling you is acting in the central nervous system and it's helping relax muscles. So usually we're going to be using this medication to treat spasticity. What is spasticity? Spasticity is like muscles are going to be feeling stiff, tight, and hard to move. So the patient may have symptoms like stiffness, some spasms like twitching movement, some clonus, which is like bounce or shakes rapidly on its own, like the muscle, or the arms and legs are going to be like in weird positions because of the stiffness. So usually you're going to see this in conditions like multiple sclerosis, spinal cord injuries, or in other spinal cord disease. So as I'm telling you, if this is to treat conditions in which there's an issue in the spinal cord, then this medication is going to be acting in the spinal cord. Okay, so how does it work? Like baclofen is going to bind to GABA V receptor. GABA, if you remember a little bit from, is going to be an inhibitory neurotransmitter. So if it's inhibitory and you are putting a GABA agonist, what are you getting? Inhibition. You're getting relaxation. So baclofen is going to be binding to the GABA2 receptor. And by doing this, you're going to get all the excitatory signals, all the spinal reflexes, and all the muscle spasticity down, right? So with that, you're going to have a muscle that is more relaxed and that is actually going to be working properly, that is not going to be that stiff. Okay, so this doesn't mean that it's going to fix any injury. Okay, baclofen is just helping relax the muscle to improve function and comfort, to reduce the spasms. All right, now when do we use it? I told you we usually use it for conditions that are related to spasticity, like stiffness. That are really also conditions that are related to the central nervous system, especially the spinal cord. So we're going to be using like in multiple sclerosis, because we're going to be helping reduce all the increased muscle tone spasm caused by multiple sclerosis. Okay. Also, if the patient that has a spinal cord injury producing spasticity, we're going to be treating spasticity with this. So just pretty much think that whenever the patient has spasm, rigidity, you can use a muscle relaxant. Makes sense, right? Like I told you, clonus, which is rhythmic voluntary contractions. Spasms, which is like a flexion that could be painful. Rigidity. So we're just relaxing, centrally acting muscle relaxant, right? Now, usually you have them in the form of tablets, all right? But in some cases, you're gonna be seeing the patient are gonna use something called intrathecal pump. What does intrathecal mean? Intrathecal means that the medication is being administered, injecting them directly into the spinal canal. Yes, the vertebra, injecting spine in the spinal canal. So the intrathecal route is powerful because it will be delivering the medication closer to the spinal cord, but it also means, I mean, just thinking about that already tells you, oh, this sounds bad, this sounds dangerous. It is dangerous. So we have critical safety risk. So if there is any missed refill appointment, any pump malfunction, any catheter problems, we have high risk for infection of any kind of complications. All right. So it can create dangerous withdrawals or even overdose situations. So we have to be really careful with this. So intrathecal, it goes straight to the spinal canal, and because of that, is really dangerous. Easy, but usually we take speed. All right. So if we are talking about central nervous system depression with baclofen, you have to think on what? Drowsiness, dizziness, sedation. You have to be careful with this, especially in all patients, because you have increasing the risk for falls. Also, in all patients, their muscles are already kind of weak. So if you're giving a medication that is a muscle relaxant, you're getting more weakness and more hypotonia. So with that, you're increasing the risk for falls. So you have to be careful with that. Now, baclofen is usually eliminated through the kidneys, is cleared by the kidneys. So if the kidney is damaged, or if there is any kidney damage, then you increase risk for toxicity. So you have to check bone, you have to check all the monitor, you have to monitor for renal function, all right, and you have to adjust the dose as needed. How does it look like a toxicity risk or a toxicity because of with baclofen? It will look like respiratory depression. The overdose will look like that. So you're gonna have slow or shallow breathing, confusion or responsiveness. So severe overdose can be life-threatening. So the patient needs to seek help immediately, or you have to call the provider. Now, because this is a depressant, you have to avoid alcohol, which is a central nervous system depressant, or you have to avoid any other central nervous system depressants, because all of those are going to increase drowsiness, are going to increase all the risk for falls, and going to increase the risk for overdose. All right. So you don't not combine this with any opioids, benzodiazepines, antihistamines. Make sense? Before I forget, these medications needs to be tapered off. That means that you just don't stop immediately. You just don't stop the treatment. You just have to start lowering the dose slowly. Make sense? And this is causing depression and sedation of the muscles, like relaxation. What happens if you do relaxation on the GI? You get constipation. So you have to remember these patients to take enough fiber, enough hydration, and to have try to be a little bit active to reduce any risk for constipation. Make sense? Alright, so baclofen is, again, final recap, centrally acting skeletal muscle relaxant and GABA B agonist. It will be decreasing the excessive spinal reflexes activity and will be reducing the spasticity. So you have to think on multiple sclerosis, spinal cord injuries, flexor spasm, clonus, rigidity, and painful muscle tone. It is not the best fit for routine muscle strains or ordinary musculoskeletal soreness. As you've heard, this is more for neurological spasticity. So also the major adverse effect is drowsiness, dizziness, weakness, sedation, hypotonia, anything that is like relaxation. So severe toxicity can cause respiratory depression, but also seizures, loss of consciousness, or coma. Now, the patient with renal impairment are at a higher risk because baclofen is mostly cleared by the kidneys. The biggest safety warning is withdraw. Do not stop baclofen abruptly. Abrupt discontinuation can cause rebound spasticity, hallucinations, seizures, side effect, high fever, So the patient needs to remember that they have to taper off, because even death can happen because of not tapering off this medication. You have to taper off. For intrathecal pump patients, intrathecal again is through the spinal canal. So pump safety is non-negotiable. So you have to teach the patient to keep refill appointments, to respond to pump alarms, to report any return of spasticity, any itchiness, any symptoms, just in case. Now, the NCLEX pattern is usually more like baclofen relaxes spasticity muscles, but the nurse protects the patient from sedation, false respiratory depression, renal accumulation, central nervous system depression, or abrupt withdrawal. Sounds good? Anyway, so hopefully this was useful for you guys. Leave a comment below, subscribe. Let me know if you like this format of videos and if I can do what topics you want me to do next. Have a good one and enjoy.